हेलो एवरीवन, अस्सलाम वालेकुम। आज हम अपनी जो 6 एपिसोड्स पार्ट्स टू यूके का पहला एपिसोड स्टार्ट कर रहे हैं। एपिसोड को स्टार्ट करने से पहले मैं एक छोटी सी कोटेशन बताना चाहूँगा और ये आप सबको देख के ही मेरे जहन में आ रही है। ये स्टीव जॉब्स ने कहा था, उसको एक ग्रेजुएशन में बुलाया गया था सेरेमनी में। उन्होंने 10 मिनट की स्पीच की थी, जो कि डेफिनेटली ना मैं अभी करूँगा ना आप सुनने के मन में हो, क्योंकि आप सबको भी वकास भाई का इंतज़ार है। लेकिन उसकी एक लाइन मैं आप लोगों के सामने रखूँगा। उन्होंने कहा था, व्हेन इट कम्स टू लर्निंग स्टे हंग्री स्टे फुलिश। जब सीखने की बात आए तो बेवकूफ़ बन जाओ और भूखे बन जाओ। तो आप लोगों का ये मैसिव रिस्पॉन्स देखकर मुझे लग रहा है कि आप लोग सारे इस कोटेशन पे फिट आए हो। तो सबसे पहले ह्यूज राउंड ऑफ अप्लॉज आप सबके लिए। और मैं आप सबको कॉन्ग्रेचुलेशंस कहना चाहता हूँ कि आपके अंदर ये वाई वाली फीलिंग आ गई है। और अब वाई वाली फीलिंग आ गई है, अब बस हाउ वाला तरीका है ये डॉक्टर वक्कास आपको बताएंगे। वाई आप अपने अंदर आपने ढूंढ ढूंढ लिया है। बाकी मैं उनकी बात करूँगा। हमें लगता है कि यार कभी-कभी इंसान हैं, हमें ख़्याल आता है कि यार मैं कहाँ से कुछ कर पाऊँगा? कभी आईने में अपनी शक्ल देखते हैं, अबे तू क्या करेगा यार? यार दोस्तों के सामने चाय पीने बैठते हैं तो अचानक कोई एक बंदा बोलता है, यार तेरा भाई ये करेगा, तेरा भाई यूके जाएगा, ये बड़ा काम करेगा। तो 2 लोग आपस में कहका मारते हैं और कहते हैं, अबे शक्ल देखी है तूने अपनी? तो हम भी कहते हैं यार बात तो ठीक ही कह रहा है यार। इसी तरह हमारे लम्स के ही ग्रेजुएट हैं डॉक्टर वकास समेजो। लेकिन कहते हैं ना, टू योर टूडेज इल्यूजन इज योर टुमारो रियलिटी। मैं इसको अंडर ग्रेड से जानता हूँ, तब से ये बंदा कहता था कि यार जाजिब भाई, आप मुझे कुछ सालों बाद ना आप मुझे बड़े मकाम पे देखोगे। मैंने कहा कि देख, मतलब जाहिर सी बात है, उसके अंदर तब से वो बातें थी और वो उसका इल्यूजन था। कहते हैं ना, जो झूठ आज आप अपने आप से बोलोगे या जो वो आपकी कल की हकीकत होगी। तो अब अभी से अपने माइंड को पॉजिटिवली ट्रेन करना शुरू हो जाओ। तो वकास भाई भी हम में से ही थे, लम्स के इसी कॉरिडोर में, इसी ही मतलब एमबीबीएस के कैंटीन में, सीसी के पेटीज, फाटक, ये वही वही इतने सारे सारे रास्ते किए हैं, सारी चीजें की हैं। और माशाल्लाह अभी ये यूके में साहब बैठे हैं और माशाल्लाह पाउंडों में पैसे कमा रहे हैं और एक लग्जरियस लाइफस्टाइल कमा रहे हैं। और माशाल्लाह देखो, मैं इसको अभी बात चल रही थी, मैं तो सलाम कर रहा था कि यार बड़ी बात है, वहाँ लोग यूके में बैठ के माशाल्लाह इनकी जॉब सैलरी इतनी ज़्यादा होती है। मैंने कहा फिर भी तुम लोग इतना टाइम निकाल पा रहे हो। कह रहे नहीं यार जाजिब भाई, देखो बात ये है कि मैं नहीं चाह रहा जिन मुश्किलों से मैं गुजरा किसी और को भी गुजरना पड़े। और ये तो मुझे अपॉर्चुनिटी अल्लाह ताला ने दी है कि मैं लोगों अपने लम्स के लोगों को या जो भी है मैं उनको गिव बैक कर सकूँ। तो क्वाइट इम्प्रेसिव वकास भाई। और इनका जो अभी प्रेजेंट करंट इंट्रोडक्शन है, ये एनएचएस स्पेशलिटी रजिस्ट्रार एंड आईएमजी कैरियर एडवाइज़र है। ये अपने इनको ज़रूर इंस्टाग्राम पे फॉलो कीजिएगा, या बताने जिस चीज़ में ये हैं ये ज़रूर खुद ही आपको बताएंगे। ये प्रॉपर सेशंस भी करवाते हैं लंबे, मतलब जिसमें 5-6 घंटों के डिटेल सेशंस होते हैं, जिसमें वो पता नहीं ए टू जी सारी चीज़ें गाइड करते हैं। वो सारी चीज़ें होती हैं, वो मज़ीद आप उनसे ये स्टफ पूछ सकते हैं। ये मैं इनकी सक्सेस स्टोरी सुन रहा था कि इनके कैंडिडेट्स की, कि जो इनके थ्रू यूके में जॉब एप्लीकेशन सक्सेसफुली कर सके। तो मुझे भी बहुत गर्व था कि यार वकास भाई वाकई ये बंदे ने जो अंडर ग्रेड में बोलता था और माशाल्लाह आज उस बंदे ने करके दिखाया है। तो मैं मजीद टाइम नहीं लूँगा और मैं वकास, ओवर टू यू। ऑडियंस
Thank
आपके
you.
हवाले।
Thank you, Jazeb Bhai, for your kind introduction. And first of all, I'm really thankful for you to providing me this opportunity to give back to my community. So, as Dr. Jazeb already introduced me, so I'm going to give my brief introduction. Myself is Dr. Waqas Samejo, and I'm working as a specialty registrar in psychiatry in NHS Scotland. So, in our today's session, I will discuss regarding the different pathway in which you will get the registered with the General Medical Council and start your practice in the UK. So I would try to interact with my native language in Urdu and Sindhi that will help you to get a better understanding regarding all the system and this stuff. देखें, फर्स्ट ऑफ ऑल यूके आने के लिए हमें यूके में एज अ प्रैक्टिस करने के लिए एज बीइंग अ डॉक्टर हमें जीएमसी से रजिस्ट्रेशन जो है ना रिक्वायर्ड होती है, ठीक है। अब रजिस्ट्रेशन के लिए हमारे पास डिफरेंट पाथवेज हैं. So please make sure that whenever you are graduating from your medical school, you are going on the right direction. Many doctors will say that you should go to pursue the MRCP, either you should go to pursue the MRCS, either you should go to pursue the Plab exam. So please make sure that always take a guidance from the experienced person. Never ever take a guidance who are already in the same journey. I saw the doctors and I already know from my previous histories, the doctors who are still stuck in the MRCP exam. My batchmates, even though some of the batchmates I know that they have been stuck in the MRCP journey because they started with the MRCP. To be honest, MRCP is not easy to do as compared to the Plab and MRCS and other exams. So please make sure that before starting any journey, you should have a proper research. Okay, so my advice for the junior doctors means who have been recently graduate and who are about to graduate. So please make sure that you should go on the right direction. Let me give you different options in which you can get the registered with the GMC. So before getting the GMC registration, you need to cover the different, you need to complete the different exams. So there are different exams that you can pass as a junior doctor. As a senior and middle grade doctor, you can. So first one is Plab journey. Okay, so the Plab journey is usually comprised of two exams, Plab 1, Plab 2, and first exam is regarding the OET, English language test. Okay, and the second part is MRCP. If you want to pursue your career by doing the MRCP, then you should go with it. But to be honest, MRCP is difficult than a Plab exam. And MRCP comprised of MRCP part 1, part 2, and then PACES exam, and at the end you need to give the OET as well. Okay, so and the other thing is that MRCS exam is also like same MRCS part 1, part 2, and then OET. And if you want to pursue your career as a gynecologist, then you can go with the MRCOG exam. If you want to pursue your career as a pediatric, then go with the MRCPCH. देखें सब एग्जाम्स का मकसद है at the end you need to get the GMC registration. Okay, so please make sure to take the wise decision. So according to me, the wise decision to get the GMC registration for the junior doctor and the very easiest pathway is the Plab pathway. लोग आपको कहेंगे कि प्लैब में जॉब्स नहीं हैं और लोग स्ट्रगल कर रहे हैं. I am engaged with the IMG doctor for past 8 months and I helped around 500 doctors to get a job in the NHS and 800 doctors who got an interview invitation. So I am closely engaged with the IMG's doctors and I know the job market. Even though the job market is saturated, but still daily on regular basis the doctors are getting interviews and the job offers, so it means that still there is the job market when they are invited the candidates for the interview. Let me give you my example. We were 10 batchmates who started our journey back in 2020 with a Plab pathway. Even though without having a much clinical experience, we all get a job in the NHS and alhamdulillah currently we all are working in the NHS. तो कहने का मकसद ये है कि जॉब है अभी भी एनएचएस में. ऐसा नहीं है कि मैं अभी ग्रुप में एक कमेंट पढ़ रहा था बिफोर स्टार्टिंग द सेशन, समवन रिकमेंडिंग दैट यू शुड गो द एमआरसीपी एंड एमआरसीएस प्लैब पाथवे पे जॉब्स नहीं हैं. मुझे नहीं समझ आता कि लोग ऐसा क्यों कहते हैं. either they are very very well experienced or they have nothing. बिकॉज देखें बिफोर गाइडेंस आप प्लीज मेक श्योर करें कि आप उस पाथवे से गुजर चुके हैं और आपको अच्छा एक्सपीरियंस है. अगर नहीं है तो प्लीज काइंडली किसी और को दूसरी तरफ जो है ना वो ना करें, डीमोटिवेट ना करें. क्योंकि देखें अभी मैंने देखा है कि काफी जूनियर डॉक्टर्स में मैं इवन दो व्हेन एवर आई गॉट अ मैसेज फ्रॉम द जूनियर डॉक्टर्स एक ही क्वेश्चन होता है कि हम प्लैब कर लें उसके बाद हमें जॉब मिलेगी या नहीं मिलेगी. देखें जॉब डेफिनेटली मिलेगी, ऐसा नहीं है कि मैंने अभी कोई भी ऐसा डॉक्टर नहीं देखा फ्रॉम आवर बैच. देयर आर अराउंड 30-35 doctors who are in the journey and some of them have already cleared the exams and they got the GMC registration and alhamdulillah all of them got a job offers. कोई ऐसा नहीं है कि जिसको जॉब ना मिली हो. ठीक है, सबसे पहले दिमाग में ये बात निकाल लें कि जॉब्स नहीं हैं, जॉब्स हैं एनएचएस में. ठीक है, अब जॉब्स के लिए हमें क्या करना होता है कि हमें अपनी एप्लीकेशन को रिफाइन करना होता है. अब डिफरेंट पाथवे जैसे एमआरसीपी है, एमआरसीपी इज अ वेरी लेंथी इस वजह से है कि थोड़ा डिफिकल्ट भी है और ये थोड़ा टाइम कंज्यूमिंग भी है क्योंकि हर बंदा ये चाहता है कि मैं जल्दी यूके पहुंच जाऊं. ऐसा नहीं है कि अगर आप प्लैब के जरिए आएंगे और एमआरसीपी के जरिए आएंगे डायरेक्ट आप जो है कि एज अ कंसल्टेंट एज अ जो है कि ट्रेनिंग स्टार्ट कर लेंगे. भाई ऐसा बिल्कुल भी नहीं है. ये सारे जो भी एग्जाम्स हैं ये सब आपको सिर्फ जीएमसी रजिस्ट्रेशन दिलाएंगे. अगर आप एमआरसीपी के जरिए आएंगे आपको जीएमसी रजिस्ट्रेशन मिलेगी, प्लैब के जरिए आएंगे आपको जीएमसी रजिस्ट्रेशन मिलेगी. तो इट मीन्स के एट द एंड यू ऑल विल गेट द जीएमसी रजिस्ट्रेशन. ठीक है, तो कोशिश ये करें कि जितना इजी और क्विक पाथवे हो वो चूज करें. इट्स ऑल अबाउट द जीएमसी रजिस्ट्रेशन. अब आ जाए जॉब एप्लीकेशन के हवाले से. अगर आप अंडर ग्रेजुएट स्टूडेंट हैं या आप रिसेंटली ग्रेजुएटेड हैं, ठीक है, तो प्लीज मेक श्योर यू आर गोइंग ऑन द वन डायरेक्शन. मैनी डॉक्टर्स, मैं आपको अनसक्सेसफुल स्टोरीज बताता हूँ कि उन्होंने क्या गलतियां की हैं. हमारे जूनियर्स ने हमारे बैचमेट्स ने जो आपने नहीं करनी, ठीक है। तो सबसे पहले गलती तो उन्होंने ये की कि जब वो ग्रेजुएट हुए, दे आर नॉट ऑन द वन डायरेक्शन, they were going in the training in the Pakistan and they want to pursue their career in the UK. At the end, they were stuck in both. वो दोनों अभी तक नहीं कर पाए, वो प्लैब 1 के एग्जाम में भी फेल हो गए और ट्रेनिंग भी नहीं कर पाए। तो ये देखें, जब आप मैं आपको अपनी एग्जांपल देता हूँ। व्हेन वी वर ग्रेजुएटेड बैक इन 2019, व्हेन वी स्टार्टेड अवर जर्नी फॉर द OET एग्जाम, to be honest, we only stuck ourselves to the OET exam. Okay, so we never go in another direction. हमने ना ट्रेनिंग का सोचा, ना FCPS का सोचा, हमने काफी सेक्रीफाइसेस की, क्योंकि लोग कहते हैं कि यार रिस्की पाथवे है, हमें हमारा बैकअप तैयार करना चाहिए। भाई जब आपका समझें कि जब आपने सेकंड ऑप्शन आपने अपना तैयार कर लिया, तो आपका फर्स्ट ऑप्शन की आपकी इंपॉर्टेंस खत्म हो जाती है। तो मीन्स आप अपने श्योर नहीं है अपने गोल पे। सबसे पहले आप अपना गोल फिक्स करें कि आपने यूके ही आना है या पाकिस्तान में रह के ट्रेनिंग कंप्लीट करनी है। अगर आपने यूके आना है तो भूल जाएं पाकिस्तान की ट्रेनिंग को और अगले एग्जाम्स को। फिर आप अपना फोकस 100% फोकस जो है कि आप अपना प्लैब एग्जाम्स, MRCP, MRCS जो आप एग्जाम देना चाह रहे हैं वो करें, ठीक है। तो अब कोशिश ये करें कि जब आप एग्जाम्स की तैयारी स्टार्ट करें, तो मीनवाइल ड्यूरिंग योर एग्जाम प्रिपरेशन यू शुड फोकस ऑन योर प्लैब एग्जाम, MRCS, MRCP, कोई भी आप एग्जाम चूज करना चाहें, बट मीनवाइल डू वर्क ऑन योर एप्लीकेशन। ओके, what's the good points that will help you to get an interview and a job offer in the NHS? एक देखें, फर्स्ट ऑफ ऑल जब हम लोग हमारी एप्लीकेशन फिल करना स्टार्ट करते हैं NHS की, तो इट्स टोटली डिफरेंट फ्रॉम आवर पाकिस्तान जॉब एप्लीकेशन, द CV। हम पाकिस्तान में 2 पेजेस 3 पेजेस की CV चाहिए होती है, बट यहाँ हमारे पास 40-45 पेजेस की जॉब एप्लीकेशन होती है। ये बड़ा कॉम्प्लेक्स प्रोसेस है, ठीक है। तो अभी देखें, इस वक्त मैं आपको जस्ट ब्रीफली गाइड करूंगा, क्योंकि यू आर नॉट इन दैट पाथवे, सो यू विल नॉट बी एबल टू गेट what I will try to explain you in a detail, but I will give you a brief idea that which will help you to get a good points in your application whenever you will complete your exam, whenever you will complete your MRCP Plab, and when you will get your GMC registration, then you will uh, think that either I have got these points or not. Okay, so first of all, if you find any opportunity to teach a medical student, so please try to involve in the teaching. Okay, but before the teaching, your clinical experience is very, very important. Please be clinically engaged. Okay, डोंट टेक अ गैप लाइक USMLE वाले स्टूडेंट करते हैं कि वो गैप ले लेते हैं, बट प्लैब का एग्जाम प्लीज मेक श्योर दैट यू आर क्लिनिकली एंगेज। आपका क्लिनिकल एक्सपीरियंस इज रियली इंपॉर्टेंट। ओके, फर्स्ट ऑफ ऑल आपने कोई गैप नहीं लेना अपने कैरियर में। एग्जाम्स इजी हैं, एग्जाम्स इतने डिफिकल्ट नहीं है कि आप जो है कि अपना 4-5 महीने का गैप ले लें और एग्जाम पर फोकस करें। आप अपनी ड्यूटी के साथ भी कर सकते हैं, ठीक है। तो कोशिश करें कि आप क्लिनिकली इंगेज्ड रहें, फर्स्ट ऑफ ऑल। सेकेंड थिंग इज दैट यू नीड टू involved in the teaching. If you are working in a Karachi or in a Hyderabad, कहीं भी आप काम कर रहे हैं, अगर आपको अपॉर्चुनिटी मिलती है as a demonstrator, as a tutor, you should have to avail this. This will also increase a good point in your application. Okay, आपका क्लिनिकल एक्सपीरियंस हो गया, आपका टीचिंग एक्सपीरियंस हो गया, along with this क्वालिटी इंप्रूवमेंट प्रोजेक्ट एंड ऑडिट। देखें, अगर आपको मौका मिलता है टू इन्वॉल्व इन audit and a QIP project, then please do participate in, because it will definitely increase your points in your application. Okay, so what does it mean by audit and QIP? It's a very, very comprehensive discussion, and it's a very long points that needs to be covered to do the audit and QIP. But I'm going to give you a brief summary what's actually the audit and what's actually the QIP is. The definition of audit is comparison of the current health system with the standard set by the hospital. Okay, if you make a mind to do the audit, then please do study regarding all the steps of the audit and then try to discuss it with your supervisor, with your consultant. But in our home country, to be honest, our consultant doesn't have a much idea regarding the audit and QIP stuff. So now it's your own duty to initiate and let your supervisor know that you want to do this stuff, and it will help in your application. Okay, so in the audit there are different steps: data collection, analysis of the data, comparison of the current practices with the standards set by the hospital, and then doing the re-audit, and the final step is presentation of the audit. Okay, as I mentioned that it's a very, very comprehensive thing to understand. I will share a link in the group, so you should have to read this and try to do the audit as well. And contrast, there is another thing is QIP, what we call quality improvement project. Okay, so quality improvement project means the project that needs to be done to improve the quality care of the patient. Okay, and it's an easy thing to do as compared to the audit, and you can easily do by working in a basic health unit in Pakistan, by working in a secondary care hospital and a tertiary care hospital. QIP is a similar thing like audit, but there's only difference between audit and QIP. In the QIP, we are not comparing the current guidelines with the standard set by the hospital. Okay, but in contrast, in the audit, we are comparing the current guidelines with the standard set. Here in the QIP, you are just finding the problem and then giving the solution. What does it mean? Like, let me give you an example. If you want to do a QIP in a basic health unit, okay, then आप देख रहे हैं कि यहाँ पर हमारे पास काफ़ी पेशेंट्स आ रहे हैं बेसिक हेल्थ यूनिट में with a chest pain, okay, and अब आपका ये हो रहा है कि आपने पेशेंट्स की क्वालिटी को इम्प्रूव करना है, क्वालिटी ऑफ लाइफ को इम्प्रूव करना है, तो आप क्या करेंगे? आप ये कोशिश करेंगे कि इसके 3 स्टेप्स हैं: डेटा कलेक्शन, एनालिसिस ऑफ द डेटा एंड इम्प्लीमेंटेशन ऑफ द चेंजेस। डेटा कलेक्शन में आप ये करेंगे कि आप ये कलेक्ट करेंगे डेटा कि अगर आपके पास ओपीडी में 40-50 पेशेंट्स आ रहे हैं, ठीक है, अब आप क्या करेंगे कि आप इनमें से इनकी पेशेंट की एज देखेंगे और फिर इनमें से चेस्ट पेन की कंप्लेंट देखेंगे। अब जब आप एनालाइज करेंगे तो आपको पता चलेगा कि इसमें से 50 आउट ऑफ 20 पेशेंट्स आर कंप्लेनिंग विद अ चेस्ट पेन एंड इट्स seems to be MI. Okay, but you are not able to diagnose in your current setting because you don't have a tools to diagnose this. First of all, you need to do the ECG. Okay, so आप क्या कर रहे हैं? आप अपना जो है कि ये मेडिकल डायरेक्टर से या मेडिकल सुपरिटेंडेंट MS से जो है कि वो डिस्कस करें कि आपने ये चीज़ करनी है, आपने क्वालिटी इंप्रूवमेंट प्रोजेक्ट करना है, जिसमें आप क्या करें, ECG आप लेकर आ रहे हैं अपने सेंटर में, ठीक है? अब आप ECG लेकर आ गए, अब आपने ECG पेशेंट्स की स्टार्ट की, so it's mean that you completed the third step, which we call implementation of the changes. Okay, after doing the implementation, you done your QIP. Last step is presentation of the QIP, where you are going to present it. Either you can present it in a weekly meeting. If you are working in a PPHI, then there's a monthly meeting in which you can present that I have done the QIP, in which I brought the ECG machine and I collect the data and analyze the data, and at the end I implement the changes. So ये आपके पास example है QIP की, and it's a very easy to do in your current setting. Either you are working in a BHU, secondary care hospital, or in a tertiary care hospital. Okay, so this stuff you should have to do during your Plab journey. So whenever you will complete your journey, you will look back, you will found that you have completed the audit, you have completed the QIP, you participate in the teaching, and you have a good clinical experience. So these stuff are really important for your job application, okay, rather than only the clinical experience, because here in the NHS, they demand a doctor who is an all-rounder. All-rounder means who's good in a clinical work as well as in a non-clinical work. Okay, so please make sure that you are working on all these points what I discussed with you today, and please make sure to choose the right pathway. Doctors been confused that either we need to go with the MRCP, MRCS, or Plab exam. Okay, so as I mentioned earlier, that at the end of all these pathway, you will get the GMC registration. Okay, no any pathway will directly lead you to the training, neither the MRCP nor the MRCS or neither the Plab. Okay, so please make sure you are going in the right direction. It depends upon your budget and a clinical experience. If you are old graduate, means you graduated 6 years, 8 years back, and you have done training in your home country, like you have completed the FCPS exam, then I would personally suggest you can go with the MRCP because you have a good knowledge and you can do all this stuff. But still, you can do the Plab. I know the doctors who have done the Plab exam, who've been graduated in 1998, 2003, 2005, with a 12 years, 20 years, 22 years of clinical experience, and they go with the Plab exam, and at the end they did the exam in a 2 years, 1.5 years, and at the end they got the GMC registration and the job offer. Okay, so MRCP is a very good thing. If you want to do, then please go ahead, but please make sure that it's a very, very complex and a tiring as compared to the Plab. Plab is easy to do, and in the meanwhile, during your Plab preparation, you can do the other stuff as well, like your clinical working along with teaching, audit, QIP. So please make sure whenever you are completing your journey, you are getting the GNC registration, you have a very good portfolio in which you have all these points. And these points are very important to get a job offer in the NHS. That will definitely help you for interviews and then a job offer. Okay. The ideal length to get a job in the NHS totally depends upon your application. So how good you craft your application, how many good points in your application. If you have a very good points, like if you have a teaching, you have a research, you have a audit, you have a QIP and a clinical experience, then definitely you may get an interview and a job offer in a 2 month or a 3 month. But otherwise, the average time of interviews and offer is around 3 to 6 months. If you are going in the right direction and you collected all these points, okay. So please make sure that you are very well prepared for this journey. But before that, I am seeing that many of the 90% of today, uh, the audience is from medical graduates, recent medical graduates, and those who have started the journey and those who are supposed to start their journey. So please make sure go in the right direction, and hopefully, inshallah, at the end you all will make it. And if you have any particular question or if you have any concern, you can ask in a chat box. I will try my best to assist you. And many doctors been confused after getting the GNC registration. Which jobs we can do. Okay, so after getting the GNC registration, you can start as a non-training job. Okay, in the USMLE में ऐसा होता है कि you are starting direct the training, but here in the UK you are not able to start training directly. So first of all, you need to do the non-training stuff, and then after doing the non-training job, you will appear again in the exam for the training, and it's a different exam. It's not a Plab and it's not a MRCP. So this is called MSRA IMT training. This is another story, what we will discuss later on. But now your main focus should be on the application and what are the good points that will help you to get an interview and a job offer in the NHS. So please make sure you will work on all this stuff. So after getting
जी, काइंडली हमें 2 मिनट दें, हम इसको सॉर्ट आउट करते हैं। नहीं, वकास आवाज़ नहीं आ रही अभी आपकी। नहीं, आवाज़ नहीं है। एक्सट्रीमली सॉरी फॉर इनकन्वीनियंस। अभी इसको सही कर लेते हैं और फिर दोबारा जहाँ से प्रॉब्लम क्रिएट हुई है वहाँ से दोबारा स्टार्ट कर लेते हैं।
Now it's audible.
जी, जी, वकास भाई बिल्कुल ऑडिबल है। अब ठीक है, परफेक्ट, परफेक्ट।
चलें, थैंक यू, थैंक यू। If anyone not audible, still.
वकास भाई आपकी आवाज़ ठीक है। वीडियो कैमरा ऑफ है आपकी? हाँ, आवाज़ ठीक है।
आप देखें, एक्चुअली मैं कमेंट्स में देख रहा हूँ ऑन अ लाइव चैट।
हाँ, कमेंट्स दिखाई दे गई ना आपको? हाँ, बस आपकी
जी,
आवाज़ क्लियर आ रही है। वो पुराने शायद कुछ कमेंट्स होंगे, अभी आपकी आवाज़ क्लियर है।
अच्छा, अभी अगर कोई कमेंट करे तो मुझे पता चल जाएगा। और वीडियो ठीक है अब? आई एम
आपकी
नॉट श्योर।
आपकी कैमरा ऑफ है।
Yeah, actually, I'm not able to get the comment. Sir is not audible. Dr. Sayyeda Ruqayya. I'm not sure what's been happening. You are audible, Dr.
ठीक है।
Vedina. Audible
हाँ,
now. It's
वंदना
perfect.
ऑडिबल
Okay.
आ रहा है, कमेंट सबके आ रहे हैं।
Actually, मैं comments नहीं देख पा रहा. If I'm going for the comment, just give me a moment. I'm going to log in with my laptop so I can read the comment from there and then I can answer to it. Just give me a moment, please. No video. Yeah, I'm going to on my camera. Just give me a moment, please. So
ओके, ओके।
now you can ask all your questions in the comment box. So I will try to give your answers according to your questions. So I was not able to read your questions previously. If you have any question, please feel free to ask now here in a comment box. Yeah, I will try to resolve the video in a while. Just give me a moment. Meanwhile, you can ask your questions in a chat box. So if you have any concern or any question, feel free to ask. How long is the Plab pathway? Doctor, it's actually depends upon totally on your own luck and on your own finances and this stuff. If you have a good finances and you have a plenty of time, then you can easily cover this journey in a 1.5 years. But the average time is mostly like a 2 years. It may not go beyond the 2 years. You can complete the whole pathway in a 2 years, as compared to the MRCP and MRCAM, which may take a lot of time and a lot of energy, to be honest. So if you want an easy pathway to enter in the UK, then please go with the Plab. Please continue from what kind of job to start. Okay, so whenever you will get the GMC registration, you will start with a non-training job. Okay, so the non-training job you can get in any of that specialty. Either if you want to pursue your career in the psychiatry, you can do the psychiatry. Just you need to get an interview and a job offer. The interview stuff is a little bit tricky and comprehensive as compared to other things, because if you will get an interview, like I'm working in a psychiatry. To be honest, I didn't had a previous experience in the psychiatry back home in my country, so still I got a job offer in the psychiatry. So it's totally upon you, how you are building your application and how you are gathering the good points that will help you to get an interviews and a job offer. Video not working, but you are audible. Thank you. Just give me a moment. I am going to resolve this video issue as well. Meanwhile, I'm trying to answer your queries. So now hopefully you can see my video. Now you are able to see the video? Yeah, that's perfect. Okay, so if you have any question now, please feel free to ask. How important is the clinical attachment? So the clinical attachment is really important, to be honest. The clinical attachment and the ALS, Advanced Life Support course. These two courses are important to get an interview and a job offer. It will definitely enhance the good points in your application. Whenever you will read the job description in the NHS, they usually demand the clinical attachment and the ALS. So meanwhile, when you will come to the UK for your Plab 2 exam, please make sure that you will do the clinical attachment and the ALS. So it may cost you a little bit more. So please make sure, if you have make your mind for 10 lakhs, then it may take you for additional 5 lakhs, because the month you will stay in the UK during your clinical attachment, along with if you will complete the ALS, it may take around 5 to 6 lakhs extra. But these are definitely help you to get an interviews and a job offers. I have recently given my Plab 2 and hopefully will pass and will start applying for a job. Shall I go for MRCS, as I'm planning to go for a surgery as a specialty? So Dr. Sami, as you already done your Plab exam, inshallah you will get a good outcome of your Plab exam. So please make sure to apply for the jobs and start your job in the NHS. And after starting your job, you can do the MRCS, MRCP, whatever you want. But please make sure, after getting the GMC registration, don't waste your time. If you will delay your journey, if you will start your MRCS, MRCP, definitely you will not be able to apply for the more jobs. If you will not be able to apply for the more jobs, then there's a chance that you will not get an interview and a job offer. Then your journey may get more prolonged. So please make sure to start for the jobs, and after entering the NHS, you can do whatever you want. Either you want to pursue your career in the surgery, then please do the MRCS. So doing the MRCS would not be help you to direct go in a training. So please make sure, if you already build your mind to do the training in the surgery, then read the points from the Royal College of Surgeon website, where you will get that which points necessary to get a training in the surgery. There are, I think, the orthopedic surgical training closed in this year. It's been around 29 points. So there are different points for the training exam, but we are not going in a detail of the training stuff now, because it is not necessary. Now your focus should be on the non-training job, and after getting the non-training, you should prepare for your training stuff, like I am doing. I got my non-training job, and currently I'm doing the non-training job, and inshallah, hopefully in the next upcoming training exam, I will appear and will pursue my career according to my desire and according to my interest. Okay, so what's a non-training job? So non-training job is actually a clinical fellow job. which means that you are not in the training. So they will pay you exactly the same like you will get in the training, but it's not a training job like we are doing as a medical officer job in our home country. So it's actually a non-training job. So ये है non-training. Sir, after passing Plab 2, if we continue to practice in Pakistan by any means, then for how much time GMC registration is valid? So, Dr. Rukhsar, it's totally up to you how long you want. You just need to pay the annual fees. I know the doctors who have keep their registration for a 10 years, 20 years, so it's totally up to you. So you need to just, after 5 years, you need to go for the revalidation and just you need to pay your annual fees. As long as you are paying the annual fees, your GMC registration will be there. But you will give up your license after a year. So if by any chance if you don't want to pursue your career in the UK now, so you just give up your license and keep your GMC registration. And after 10 years, 20 years, 5 years, jab aapka dil kahe, you should apply for the jobs. And after getting a job offer, you can regain your license in a week, just submitting your job offer letter and good standing certificate from your home country. Does MPH or MBA in hospital management helps in any way? Dr. Sonu Raja, thanks for asking this question. And he was my ex-president of LUMS Scout Unit, and I was also the president of my LUMS Scout Unit back in my medical school. Sonu, that's really a good question. So, I also wish to pursue my career in the MBA, to be honest, and also got a job offer, offer letter from MBA from IOBM in Karachi, but I didn't pursue because when I asked from Haris Bhai, who was my mentor, the brother of Jazeb Bhai, he guided me that it doesn't helpful to get a job in the NHS, so I just keep it on a side because देखें आप वो चीज करें जो आपको आगे जाके काम आए ठीक है अब आप जब यूके आ रहे हैं then try to do a MPH from here. Masters Public Health from the UK is much more valuable rather than doing it from LUMS or from Pakistan. अगर आप आना ही UK चाह रहे हैं then please try to engage clinically. Clinical experience is really important to get a job in the NHS rather than doing a MPH and MBA. MPA, MPH will be counted as a non-clinical, and non-clinical things would not be much helpful if you don't have a clinical experience. Okay. What are the other options for the job except psychiatry? All options are open for you. You can do the jobs in general medicine, emergency medicine, neurology, neurosurgery, anesthesiology, um, any specialty, cardiothoracic surgery, plastic surgery, general surgery, any field you want to choose, you can do a job here in the UK. Please explain the BLS, ACLS, and PALS. Dr. Rajesh, actually BLS, ACLS, these all are the basic life support program. BLS is consists of basic life support, ACLS, advanced cardiac life support. But here in the UK, they prefer the ALS by Research Council UK, Advanced Life Support Program by the Research Council UK, which cost around £600. In PKR, it would be around 2 lakh. तो देखें ये जो कोर्स है इसकी अपनी वर्थ है एक अगर इन्होंने इसकी फीस रखी है £600 तो इट्स मीन दैट इसमें कुछ है मींस ये है तो इक्विवेलेंट कह सकते हैं ACLS के हम पाकिस्तान में ACLS करते हैं काफ़ी इदारे करवाते हैं जैसे NICVT 8 में टेक अराउंड 25,000 बट आप देखें कि जहाँ कहाँ 25,000 है और कहाँ 2 लाख हैं तो ALS की अपनी वर्थ है अगर आप यूके आ रहे हैं अगर आप प्लैब के पाथवे से आ रहे हैं जब आपका डेफिनेटली प्लैब 2 की जब आपका उसकी एग्जाम होगा मैनचेस्टर में तो मीनवाइल आप कोशिश ये करिएगा कि यहाँ से ALS कर लें अगर आप फाइनेंशियली स्ट्रॉन्ग हैं अगर नहीं हैं तो एटलीस्ट आप ACLS करें अपने होम कंट्री से Sir, what's the process for Ireland? Can you work in Ireland and work and prepare for Plab? Can you shed some light on it? So देखें अब आयरलैंड की जॉब मार्केट बहुत सैचुरेटेड है टू बी ऑनेस्ट मैं आपसे झूठ नहीं बोलूँगा एज कम्पेयर टू प्लैब IMC अगर आप रजिस्टर्ड होना चाहेंगे देखें जब आपकी मैं जब इसी पोजीशन में था जब मेरे पास OET क्लियर था तो मेरे पास काफ़ी ऑप्शंस थे मैंने सब ट्राई किए ट्राई इस वजह से किए मैंने MPH की तरफ जाना चाहा मेरे पास जो है कि MBA इन हॉस्पिटल मैनेजमेंट का ऑफर लेटर, मैंने सारा एग्जाम्स क्लियर कर दिया, उनका वाइवा भी दे दिया, मेरे पास ऑफर भी आ गया, मैं जस्ट ज्वाइन करने जा रहा था। जब मैं ज्वाइन करने जा रहा था तब मैंने मशवरा किया, तब मुझे मशवरे से यही पता चला कि इसका फ़ायदा नहीं है। सेम फॉर द आईएमसी बैक इन 2021, जब ओईटी क्लियर हुआ, आई थिंक इट वाज़ 2020, सॉरी। जब मेरा ओईटी क्लियर हुआ तो तब मैंने भी आईएमसी की तरफ जाना चाहा। मैंने जो है अपना यहाँ से पीएमडीसी से सर्टिफिकेट था, I don't know the name of that certificate in which the house job rotations been mentioned in a very comprehensive way. So I got this letter from PMDC, but when I asked from one of my senior who was working in the Ireland, he refused me. Okay, please don't waste your energy and time to do this stuff. If you already made your mind to go for the Plab exam, then please go with it. मुझे ये नहीं समझ आती कि लोग जो है कि अपना आईएमसी करते हैं, उसके बाद अपना 1.5 साल वेस्ट करते हैं, फिर प्लैब जाके स्टार्ट करते हैं, 2 साल मज़ीद करते हैं, तो मीन्स ये आपको 5 से 6 साल की जर्नी हो जाती है। तो क्यों आप लोग जो है कि अपना अननेसेसरी जो है कि टाइम इंक्रीज़ कर रहे हैं? देखें, आपका 4 से 5 लाख जो है कि आईएमसी में खर्चा आ जाता है। अगर आप जब ओईटी प्लैब करना चाहें, तो प्लैब 1 की फ़ीस मेरे ख़्याल से 70 मैक्सिमम 70-80,000 होगी पीकेआर, ठीक है? और उसके बाद प्लैब 2 का खर्चा आपका अराउंड होगा तकरीबन 10 लाख भी कर लें, तो 12 लाख। अगर आप आईएमसी में 5 लाख खर्च कर रहे हैं, 5 लाख ऊपर करके आप प्लैब दे दें और एक ही तरफ आ जाएँ। अब आप जाएँ आयरलैंड, टू बी ऑनेस्ट देयर इज़ नो श्योरिटी ऑफ द जॉब। I know my friends who have been registered with the IMC. They got the GMC registration and NHS job much earlier than IMC. मेरा फ्रेंड है, उसने आईएमसी लिया बैक इन 2021, एंड I told him that there's much saturated job saturation in the Ireland, so he did his PLAB exam and he got his GMC registration and easily got a job offer in the NHS. अभी तक उसको जो है कि आयरलैंड से उसकी जॉब्स का अभी तक उसको रिस्पॉन्स नहीं आया, which he applied back in 2021-2022. बट उसका मीनवाइल उसने जो है कि अपना जीएमसी रजिस्ट्रेशन कर ली, वो अभी एनएचएस में काम कर रहा है। तो देखें, आई वुड सजेस्ट पर्सनली कि आप एक डायरेक्शन में रहें, ठीक है? आपने अगर माइंड बना लिया है, इफ यू विश यू वांट टू कम हियर इन द यूके, देन प्लीज जस्ट स्ट्रिक्ट ऑन दैट पाथवे, ओके? इधर-उधर ना डेविएट हो। देयर इज़ अ लॉट ऑफ लोग आपको कहेंगे कि हाद में चले जाओ, आप जो है कि डीएचए के एग्ज़ाम करो, आप आईएमसी कर लो, आप जो है कि ये चीज़ें, बट इट्स वेरी डिफिकल्ट एंड इट्स जस्ट द वेस्टेज ऑफ योर टाइम एंड एनर्जी, ओके? जस्ट can you please let us know the importance of the importance between UK, MLE, and Plab? Sorry, Dr. Linta, I think you are supposed to ask what's the difference between UKMLE and the Plab. So they can, the main difference only is the name. They just changed the name. The whole process is same. Whenever you will read they have sent already the file in which they have mentioned what's actually the UK MLA is. It's totally the same. They are conducting the first part as a BCQ and the second part as a OSCE exam. So it's almost 99% same. Okay, so please don't get worried and don't get confused. Dr. Amna, if we give up the license, does it affect, decrease the chances of getting a job? No, it would not decrease your chances for the job offer. I know the doctors personally, as I mentioned, that I am engaged with the international medical graduates, and I have a WhatsApp groups in which I am engaged with 6,000 doctors from all over the world. And I know the doctors who got a job offers without their active license. And one of the doctors recently got a job offer in my own trust, in my own hospital in the ED department. And after getting a job offer, he regained his license in uh, 4 days after submitting the offer letter and a good standing certificate from your home country. What will help us to enhance our CV while being here in Pakistan? So, Dr. Kamal, so there are different things that you can do to build your CV, like to participate in a teaching as a demonstrator in a medical school, as well as doing the audit stuff, QIP, and if you want to participate in a research, then please do it. These are the things that will build your CV. But most important is your clinical experience. Please try to engage clinically. Okay. And after doing clinical work, you can do this other stuff. Am I audible? Dr. Shahla Ilyas is saying that it is not audible. Dr. Ikra Ghaffar, does MSPH help out in any way? डॉक्टर इकरा देखें ये जो कोर्सेज है ना एडिशनल MPH, ये जो आपके MBA MSPH, टू बी ऑनेस्ट इट वुड नॉट बी मच हेल्पफुल फॉर योर जॉब. सो जॉब के लिए NHS की जॉब के लिए आपका क्लिनिकल एक्सपीरियंस चाहिए और उसके साथ एडिशनली आपके लिए कुछ एक्स्ट्रा पॉइंट्स होते हैं, जैसे टीचिंग का मैंने जिक्र किया, QIP का किया, ऑडिट का किया, रिसर्च का किया. ये चीज़ें बड़ी जो है ना आपके लिए इम्पोर्टेंट है rather than doing the MSPH or MPH or MBA. Does ALS from AHA helps? Actually, Algi, AHA doesn't provide the ALS. They do provide the ACLS, which we call Advanced Cardiac Life Support. Okay. So, firstly, I would recommend to do the ALS by the Research Council UK when you will come to the UK for Plab 2 exam. If you are not affording, if you have any other issues, if you're not able to do the ALS by the Research Council UK, then please try to do the ACLS. Many doctors saying that ACLS is not recognized by the UK. It is not a fact. They do understand. The hiring managers who are sitting in the UK, who's shortlisting your application, they know we can't do the ALS by sitting in our home country, because the Research Council UK doesn't provide the ALS by sitting in your home country like in Pakistan, India, Bangladesh. Okay, then please you should do the ACLS. There's some doing something is better than doing nothing. Can you guide about ORE and how can we move to UK as a dentist? Dr. Yasin Mehman, to be honest, I don't have much experience in terms of the ORE exam. So I would request Dr. Jazib and my team, if we found any doctor who is working as a dentist here in the UK, and if we will able to find, then definitely we will arrange one of the session especially for the ORE
वकास
and
भाई
QS.
ऑलरेडी एक सेशन उनको बता दें, अपलोडेड है हमारे ORE पे डिटेल 3 घंटे का सेशन है हमारे चैनल पे.
Oh, mashallah, good. So, as mentioned by Dr. Jazib, we already have the session on ORE and stuff in our WhatsApp, in our YouTube channel. So, at the end of the session, Dr. Jazib will share a link in the group. So, please do read it. Please share the details about Europe country pathway, Dr. Sunil Kumar. So, all the European people's been coming here in the UK. So, I'm not sure why you are going to that pathway, but to be honest, I don't have much experience in terms of the Europe country. Dr. Amna, to keep the registration, do we need to give annual fees each year, or can we give the renewal fee after 5 years? So if you want to keep your registration, you need to give the registration fee every year. Okay, so please make sure to uh, fill your registration fee. And if you already been registered with the GMC, I have a separate groups in which I'm helping the ING's doctors. So if you're not in that group, so please you can join, and I'm discussing all this stuff in a details in our. I'm conducting the weekly webinar for the job application and the interviews. I'm preparing the doctors from all over the world, from junior level till consultant. So if you wish, you can attend one of the webinar in which we will discuss everything in a detail. So, sir, for Plab 2, there are trainings in UK. Can I know how much this cost and how much do they help for the Plab 2? These are trainings in UK. I didn't get your point. Uh, I think you are asking regarding the academy that preparing the candidates for the Plab 2. So there are different academies here in the UK, like Aspire Academy, Samson Academy, and Moshobi Academy. So the average cost of all these academies around £500, which could be 2 lakh in PKR. What's the best time to start the preparation for Plab, Dr. Hasnan Parad? That's really an important question, and I'm going to share a motivation story for all of with all of you. So when we graduated back in 2019 in December, to be honest, we never had an idea to pursue our career, but we fixated our mind that we should go for any foreign country. So we were confused in which country we want to pursue, because when we saw that USMLE and it was very comprehensive, so we didn't go with that. So we decided to go with the UK. So after completing our exam, to be honest, before getting the final year result, we need to start our preparation for the OET exam. So this is the ideal time when you should start with the OET exam. Okay, so in a medical school, please do focus on your medical study. Don't go with the OET and this stuff, okay? Because the final year exam itself is a very challenging part. So please do focus on these medical exams. And after completing your medical school, taking a break of a 2 to 3 days to start preparation of the OET. This is the ideal time, and please try to do the OET as soon as possible. My brother, Dr. Waqas Samejo, had and one of my very close friend, Dr. Vikram Singh. So these both are my brothers actually. So they both had done their Plab exam during the final year, sorry, during the house job, and they were supposed to give the Plab 2 exam during the house job, but due to the COVID they were not able to do. They had passed the OET exam before starting the house job. So we completed our house job in 20 oh sorry we completed our medical school in 2019 December, and we were supposed to start our internship in means house job in March. So they gave exam on March 7th, and after that they started their house job. So this is the ideal time, this is the ideal journey for all of you if you want to pursue your career in the UK. So please make sure after completing the medical school to start preparation for this exam. What is the future of doctor in England after 5 or 10 years, Dr. Krishna? So the future is bright. So if you wish, you can come. So there's no anything regarding any concerning thing regarding future of the doctors in the England. So don't worry. Is it mandatory to have a 2 years clinical experience in home country while the Plab pathway? There is no any hard and fast rule in terms of the clinical experience. I know the doctors who had completed the Plab during their internship, as I gave you the example already of my brother and one of my close friend who had completed the Plab exam in the start in the mid of their house job, and they were supposed to give the Plab 2 exam at the end of the house job. But due to the COVID time, there were no exams for the 6 months, so they were not able to complete the exam. But I think they were the ideal candidates if you wish to become motivated from them. So they were supposed to complete their journey in the house job, but unfortunately due to COVID, they were not able to do. Sir, you have sorry, job application guide, especially supporting info, please, Dr. Deep Kala Maheshwari. So the supporting statement and the job application, as I mentioned, it's a very comprehensive stuff, and we need to discuss it in a very detail. So I'm going to give you a brief idea. So for the supporting statement, you need to write according to the person specifications. Okay, so please make sure when you are applying for the job, read the person specification and the job description very carefully. So you should have to start your application by reading the person specification and write your application according to the job description, what's actually they are demanding for you. So the supporting statement is the base of your application. Okay, so please make sure you are writing it in a very, very good way and what they are actually demanding from you. So please read the person specifications. So in the person specification, they mention the criteria, what's actually they required in that particular job. Sir, do you also help consultant in getting a job in the UK? So I know the consultant, I am trying to help them with the interviews with the job application, but before that, it's your duty to complete your GMC registration. Whenever you will get the GMC registration, please reach me back. So I will try my best to assist you in the application and in the interview. I am assisting the ING's doctors for past 6 months, and I have helped around 600 doctors to get a job offer in the NHS and 800 doctors for the job interviews. So I have a separate groups for the interview preparation and application, in which there are around 6,000 IMGs doctors in the WhatsApp, which I am dealing. I'm conducting the sessions weekly to prepare them for the interviews and the applications. Any house job requirements for the Plab pathway? There is no any house job requirement. Means any specific requirements like in the IMC. Like one should have how many months of medicine and allied rotation surgery and its allied. So there's no any hard and fast rule in terms of the rotation for the GMC registration. So how much do these academies help for the preparation of Plab 2, and did you attend any? Yes, definitely the academy, to be honest, at the end it's upon your own decision and it's your own preparation, but academy may guide you how to go in a right direction. And whenever you will come to the UK, you will start your preparation with different doctors. Means in the academy, you will find the doctors from India, Bangladesh, Iraq, Iran, and Turkey, China, Egypt. So these are, you may find multiple specialties and multiple people. So it's the best choice to do the academy. And I attended the Dr. M. Moshobi Academy. After coming in UK, what do you think? Is it worth decision to come there regarding low salary, high inflation, prolonged training? Are you not sure about the salary stuff? अगर ये भी लो सैलरी है तो मुझे नहीं पता कि आपकी एक्सपेक्टेशंस कितनी हैं. The doctor's average is earning around 4,000 pounds. In the NHS Scotland, they are earning around 3,600 to 4,000 pounds. मेरे ख्याल से if you will convert it in the PKR, it would be around 14 lakh. मैं आपको ये after taxes बता रहा हूँ. ठीक है, अगर ये भी अगर आप कहते हैं कि कम है तो मुझे नहीं पता एक्सपेक्टेशंस कितनी हैं आपकी. And what's about second question? High prolonged training. Training में I agree करता हूँ कि training थोड़ी ज़्यादा है, 6 years, 8 years training, but it's worth to do as compared to if you are in the Pakistan and if you are deciding to go in another country. लेकिन training stuff में भी आपको salary मिलेगी, आपका proper जो है कि lifestyle होगा. Lifestyle से मुराद ये है कि here in the UK we are only working the 5 days from Monday to Friday and we are getting off on Saturday and Sunday. It's not the fact like if you will compare to the USA where you are working 72 hours, 80 hours, 90 hours. I know that my friends who have been working in the US. Here in the UK, you have a very good thing that it's called the quality of life. We are working only the 40 hours a week. So it means that we are working only 9 to 5 from Monday to Friday. So means at the end of the month, you are working only 20 days, 22 days. अगर आपको 20 दिन के 14 लाख दे रहे हैं, मैं कहता हूँ कि it's a worth thing to do. 1 year house job experience is enough to enhance our CV, or we need a more clinical experience. Dr. Naresh, I would suggest to get the more clinical experience. Please make sure you are clinically engaged, and whenever you will come to the UK, try to do the attachment. Clinical attachment means clinical observership in any of the hospital. That will definitely increase your chances to get interview and offer. Doctor, what's the process for Ireland? Can you work in an Ireland after OET? So after OET, you need to complete the registration, and the registration may take around 8 months to 12 months. And after getting the registration, you need to apply for the jobs, but the market is very saturated in the Ireland. So I would not recommend. If you want to pursue your career in the UK, then please go ahead. Don't waste your energy in the Ireland stuff. It may take a lot of time and it's not a very sure pathway as compared to the Plab, as compared to the GMC. I am very confused about clinical attachments, like how to get to them while coming for Plab 2. So Dr. Shakir, what you can do, you need to send the emails to the consultant. So I will share a link of the doctor's email in our WhatsApp group. If you're not in the WhatsApp group, Dr. Jazeb Bhai will add you in the WhatsApp group. So you need to send the email to all the consultant and ask them, request them for the clinical attachment. So definitely one of them will get back to you. So please make sure to apply for the clinical attachment 3 to 4 months before arriving to the UK. So this is the process to take the attachment. What is the minimum time for teaching experience? Like 2 to 3 months are enough. Dr. Kainat, it's totally up to you. If you have a 2 to 3 months, it's fine. But I would recommend at least you need to do the teaching for a 6 months. But it's not a hard and fast rule. I didn't have a teaching experience. So I only recommend that it will increase the good points in your application. Sir, did you do any clinical attachment or audit in your own Plab pathway? So, Dr. Awais Ansari, I didn't had any clinical attachment. I didn't had any audit. I do have a QIP. I didn't had a teaching and this is but still, Alhamdulillah, I got invited for 15 interviews and various job offers in a 3 months of time after the GMC registration, alhamdulillah. And I'm helping the IMG's doctors. If you, when you will complete your journey, please contact me back. I have a WhatsApp group. I have a Facebook group in which I am teaching the doctors. I am helping the IMG's doctor regularly on a weekly basis. I'm conducting the seminars, sessions, giving them guidance. So please don't get worried. If you cleared your plan, then please reach me back. Best time to do the audit and QIP. Sonu, after whenever you are clinically engaged and you wish to pursue your career in the UK, so this is the best time you can do the QIP and audit. So there is no any hard and fast rule, and there's no an expiry date for the audit and QIP. Whenever you got a time, you got an opportunity, please do it. Kindly guide about how to get a clinical attachments. I will be appearing. So for getting the clinical attachment, you just need to send the email to the consultant. I will share the links of all the consultant emails in our WhatsApp group. So you just have to send them email. So you should have to start now. I think you are coming in the November. So you should start in the month of May or June. Okay, does PPHI job clinical helps in clinical experience? Yes, Dr. Ikra Ghaffar, it will definitely help, because as long as you are clinically engaged, it will help to get, it will count as a clinical experience, definitely help you to get a job in the NHS. But meanwhile, there are other multiple factors involved, including clinical attachment, ALS, research, audit, QIP. So these stuffs are also important. Sir, can be registered by GMC after completing all three steps of MRCP Ireland? Yes, Dr. Anzar, you can definitely be able to register with the MRCP Ireland. But still, I know the doctor who recently got a job offer in the NHS. He done his MRCP Ireland. But let me double check. I'm not sure. He also done the MRCP England as well. It is important to get clinical knowledge from Karachi because there is more exposure, or can we do our house job anywhere? Dr. Vandina, that's a good question. So it's totally up to you. I decided to do my house job in Lumps, in my home, in my own hospital where I got graduated. So the thing is that the good thing is that in the Lumps, the environment is very supportive and it's not a much busy as compared to the Karachi. So I find a time to prepare for my OET and my Plab exam. So I would recommend to do the house job from where you find a time for the preparation, because your exam should be your first priority. Dr. Salah, seniors are telling that the salary is £2,800. Uh, I'm not sure whose these seniors are, but if you will, I just expose my salary. I'm not sure. So 2,800, I think they are unbanded. They are not getting banded. So which means that it's a basic salary, £2,800, but we are doing the on-call as well. So we are getting around 3,600 to £4,000. But I'm working in NHS Scotland. So in the Scotland, we have a four to £500 extra. Sir, please tell me about total expenses from OET Plab until we get a job in the NHS. So, Dr. Hamad Tariq, let me divide the total expense for you. Okay, so first of all, you need to appear for the OET exam. So, the OET exam will cost you around 1,20,000 PKR. Okay. Then for the Plab one, it may cost around 70,000. यार कोई calculate करता जाए तो it may so it total it around 2 lakh for the OET and a Plab one. अब देखें for the Plab 2, first of all you need to book the exam. So the Plab 2 booking exam fee है £935, okay, which will be around 3,40,000, 3.5 लाख कर लें, ठीक है, with taxes and all stuff. 3,50,000 for the Plab 2 exam. तो ये टोटल अभी हमारे पास हो गया OET Plab 1 Plab 2. तो ये हो गया 2 लाख और 3.5 लाख, 5.5 लाख, ठीक है। अब इसके बाद एकेडमी की फीस है और आपका यूके का ट्रैवल है और फ्लाइट्स की टिकट हैं, ये सब चीज़ें। देखें फ्लाइट की टिकट्स आपको अराउंड पड़ेंगी £600 की रिटर्न की, ठीक है, £600, और एकेडमी आपको पड़ेगी अराउंड £500। तो आप इसका एवरेज लगा लो £1,200। तो £1,200 इक्विवेलेंट टू इन पी के 4.5 लाख, ठीक है, 4.5 लाख ये और 5.5 लाख वो, ये आपका टोटल हो गया 10 लाख। अब क्या है कि ये अब आपका यूके का स्टे है, स्टे आपका अराउंड खाना पीना रिहाइश, तो ये आपका अराउंड 500 टू 600 पाउंड रहेगा। तो ये आपका, और आप मजीद ऐड कर लें तो 2 लाख, ये हो गया टोटल आपका 12 लाख। अगर आप अटैचमेंट करना चाह रहे हैं और एएलएस करना चाह रहे हैं तो आप 4 से 5 लाख एक्स्ट्रा रख लें, ठीक है। अगर आप नहीं करना चाह रहे, आप सिर्फ एग्जाम देना चाह रहे हैं, तो ये टोटल आपका 12 लाख टोटल आपका जो है ना ये जर्नी होगी। Dr. Aksa, is it true we usually come to listen that almost 35% of your monthly salary goes in a taxes there? Exactly, it's a fact. I think it's not a 35%. I'm not sure. We are getting around 5,200, and after taxes, it's been around £4,000. मेरे ख्याल से 35% तो नहीं है, it's around 20-25%. But still, I think 3,500 to £4,000 is more than enough to survive in the UK. मुझे नहीं समझ आती लोग सैलरी पर क्यों लड़ते हैं। पाकिस्तान में वी आर वर्किंग ऑन 50,000 60,000 सैलरी, और यहाँ पर अगर आपको 14 लाख भी मिल रहे हैं, लोग कहते हैं ये भी कम है। So seniors are telling that they are oversaturation and don't go for a pleb, so I'm confused. All out, kindly tell us, is a pleb worth or not? Oh, Dr. Rajput. देखें, मैं भी सीनियर हूँ, ठीक है? अगर आप मेरी सलाह लेंगे तो प्लीज़ प्लैप करें, जल्दी से जल्दी प्लैप करें और सारे पॉइंट्स पर फ़ोकस करें जो मैंने अभी आपसे डिस्कस किए हैं, ठीक है? क्लिनिकल एक्सपीरियंस, अटैचमेंट, एएलएस, ये सारी चीज़ें करें, अपना पोर्टफोलियो स्ट्रॉन्ग करें, उसके बाद मुझसे कॉन्टैक्ट करें, जॉब्स अप्लाई करें, इंशाल्लाह आई विल ट्राई माय बेस्ट टू असिस्ट यू. I am assisting the ING's doctors for past 8 months, and I helped around 500 doctors to get a job in the NHS from junior doctors till consultant level. तो मेरा नहीं ख्याल कोई सैचुरेशन है. डेली मेरे ग्रुप में लोगों को इंटरव्यूज आते हैं, जॉब ऑफर्स आती हैं. Dr. Rabia Samejo does online courses from UK certified websites such as FutureLearn, etc. can help in our portfolio. So, Dr. Rabia, I would recommend you to do the relevant courses. Okay, so what's the relevant courses you can do? You can do the Teach the Trainer courses from Oxford website, which may cost you around 150 to 200 pounds, and it's worth it to do. So these are the courses that will definitely help you to increase in your good points in your application rather than doing the irrelevant courses. Okay, the teaching courses is beneficial to do if you want any, I think any training, ACLS or BLS, it's a worthy to do. So please try to do the relevant courses rather than irrelevant. So I think all the concerns been answered. There's no more question there. So we have discussed a very comprehensive things in a detail, so there is no more question. Dr. Yes, please, Dr. Waqas, can you please speak a word about MSRA exam? Like once we are done with Plab 2, should we consider MSRA exam? So Dr. Rabia, after completing the Plab exam, please try to do the GMC registration and start the first job in the NHS as a non-training job. Okay. अगर आप उसके बाद MSRA की प्रिपरेशन स्टार्ट करेंगी, then you are deviating your mind and it may take a lot of time for you to get the job in the NHS. और MSRA में आप श्योर नहीं है कि आपका स्कोर इतना आए या नहीं है, तो कोशिश ये करें आफ्टर GMC registration do start apply for the jobs in the NHS as a non training. आप जैसे मेरी एग्जांपल है, अभी हम नॉन ट्रेनिंग जॉब्स कर रहे हैं. Meanwhile doing your non training job you can do the other stuff like prepare for the MSRA and do the training jobs after getting the first job in the NHS. So please make sure to start your first job as a non-training. Dr. Wadin, I am from Larkana and there are less exposure comparison to Karachi, but there is much time for the preparation. Should we consider strong reflexes and clinical practice or go for the preparation? They can, for the junior doctor, they would not expect much for you. Whenever you will join as a junior doctor in the NHC, they would not ask you to do the surgery on the first day, or they would not ask you to diagnose the case in the first day. Your duties and responsibilities would be very simple, like clerking of the patient, taking blood samples, participating in the MDT plan. So these are the very easy stuff you can do. You can learn by sitting in the Larkan and Jamshoro. So I would suggest to keep yourself limited to that place in which you get plenty of time to prepare for the exam. Dr. Krishna, after Plab 1, we have to join Academy. Yes, we need to join the Academy for the Plab 2. My colleague, Dr. Mahanur Mangriya, will do a session on the Plab 1 and the Plab 2 in a very detail. Hopefully, in the mid of the April, we will share the details in our group. So please do attend. It would be beneficial for all of you. How long it takes to become a consultant after Plab pathway? So it may take around 6 to 8 years at least to become a consultant. There's no any hard and fast rule. भाई सैलरी मिल रही होगी, why you are going in a, ये इधर यूके में वो सिस्टम नहीं है लाइक इन पाकिस्तान जजमेंटल वे. लोग आपको जज करेंगे कि यार हमें जो है कि ट्रेनिंग स्टार्ट करनी है, कंसल्टेंट बनना है. इधर भाई 45 years of age डॉक्टर्स बीन डूइंग देयर मेडिकल स्कूल, कोई फर्क नहीं पड़ता. Doctor, if we can afford USMLE, then which one pathway is worth it, MLE or Plab? If you can afford USMLE and you have enough time, then please do the USMLE, because of there is a lot of discussion on this. बहुत कुछ है कहने को भाई. Sir, can you guide us about OET? Do we need online subscription and how much time we need for the preparation? So, Dr. Rajput, regarding the OET, it's a very simple thing to do. Now there's a lot of resources available on the website and this stuff. There's no need to join any academy. You can do by your own. There's a 4 subtests: listening, reading, writing, speaking. So just you need to go through with the Dr. Jai the Jai videos on the YouTube, and then do start your preparation accordingly. It's easy. There's no need to do any academy. No any online subscription. Sir, which medical specialties is highly demanded in the UK? So nowadays the highly demanded is emergency medicine, because it's a very tough. So mostly doctors not doing the emergency. So emergency medicine is the highly demanded in the UK nowadays. How long it will take to pass all the steps of MRCP? MRCP exam may take around 3 to 4 years at least. Can we check online academy in Pakistan for Plab to overcome to the expenses? Dr. Abdul Matin, there is no any academy in the Pakistan that are offering the Plab 2 preparation, and it will not cost you much. It would cost around, academy cost you around £1,000, and it's a worth to do, because you know that whenever you are coming to the UK, you already expending a lot of pounds. So please make sure this £1,000 is very worth it to do. So please try to do the academy here in the UK rather than doing it in the Pakistan. So 6:41. Sorry, actually हमारा इफ्तार का टाइम हो गया है 6:50 पे. So I tried my best to answer all your queries, all your questions. So we are just winding up our session here, and I will share the link of the attachments in our WhatsApp group. And please make sure that if you are coming to the UK for the Plab 2 exam, you should have to send the email to the consultant for the clinical attachment. So this was about the brief introduction regarding all the aspects of the job application, but job application itself a very comprehensive way. And mostly आप लोग, मुझे पता है कि अभी आप मेडिकल स्टूडेंट या रिसेंटली ग्रेजुएट हैं, तो आपके लिए जॉब एप्लीकेशन सेशन की डेप्थ में जाना फ़ायदा नहीं है, क्योंकि मैं पर्सनल सेशन करता हूँ जॉब एप्लीकेशन पर, एंड इट टेक्स अराउंड 5 आवर्स फॉर मी. तो 5 घंटे का सेशन है, एंड इट्स वेरी कॉम्प्रिहेंसिव. So inshallah, hopefully, whenever you will pass your Plab exam, got your GMC registration, then please join the sessions for the application and the interview. It's a different game. I've seen a lot of people having difficulty in making Plab 2, so can you please highlight the challenges also we can to prepare ourselves in the best way? So doctor, for the Plab 2, there are multiple factors, to be honest. And one of my colleague will do a session on the Plab to Dr. Mahnoor Mangrew, inshallah, in the mid of the April, and she will discuss in a very details regarding all that stuff. But I'm going to give you some highlight. And so what you can do for the Plab 2 exam, start your preparation. At least you need to prepare yourself for 4 to 5 months, okay? And in the Pakistan, you just need to complete your academic stuff, and सारा आपका notes का सारा आपका discussion complete होना चाहिए. जब आप UK हैं तो just आप practice करें, ठीक है? So practice makes you perfect. Plab 2 is not a difficult exam if you are really prepared and you know all the basic stuff. Thank you, Vandana. Thank you, Dr. Rajput. Hopefully, you will all take your journey and you find this session motivational. If you have any concern or any queries, thank you, Dr. Sunil. After, whenever you will complete your journey, please feel free to share my WhatsApp group. I would be happy to help you. Sir, iftari ka time ho gaya. Yeah, it's been 7 minutes. So my wife is preparing for my iftar. So that's why I am relaxed here. Thank you, Dr. Sami. Okay, so I am just winding up my session here. Hopefully, you all will make your journey to the UK, to the NHS, and inshallah, I will meet you in your application and interview process. So whenever you will complete your journey in terms of your GMC registration, please keep me in touch, and I will try my best to assist you. Thank you all.
Thank you so much, Waqas bhai, or thank you so much, everyone.